Coronavirus, this great illusion that destroyed the world. Here is a look from the other side. Corona diagnosis first, then treatment. Corona does not affect the respiratory system, but rather targets hemoglobin in the blood, red blood cells, responsible for transporting oxygen from the lung to the heart, and return carbon dioxide from heart to lung. The correct diagnosis of any disease is 99% of treatment, while treatment is 1%. I explained that there is a wrong diagnosis of corona disease, which is spreading globally. And that the talk about targeting the lung coronavirus, and talking about ventilators is nothing but an act of ignorance, which is not scientific and a waste of effort and money, but a crime against corona patients. Diagnosis of corona disease. Coronavirus only targets hemoglobin in the blood, that is, red blood cells. And red blood cells are the ones that carry oxygen from the lung to the heart, and they are the ones that return carbon dioxide to the lung to be disposed of and replaced with oxygen. Coronavirus does not target the lung as it is prevalent in various countries of the world. Do not have any meaning for ventilators, because the COVID-19 virus targets red blood cells and prevents them from transporting oxygen and also prevents them from returning carbon dioxide as the virus enters the cell and moves through it. Noting that the lung is healthy and there is no problem. But the problem is in the performance hemoglobin and virus-infected red blood cells that are unable to take oxygen from the lung and are unable to remove carbon dioxide from the lung. The duty is to treat the red blood cells, not to supply the lung with oxygen as they do ignorantly. I criticized the wrong spending and wasting money towards ventilators. Because there is no point in providing oxygen in the lungs, and red blood cells are unable to get rid of carbon dioxide and load oxygen. It was also added that the inability of red blood cells to transport oxygen to the heart and cells and the inability to get rid of carbon dioxide has serious side effects, and begins with shortness of breath, and this does not indicate lung injury as they think, but rather the product of the red blood cells is stiffer. As a result, the patient begins to feel helpless. Then the extreme rise in body temperature as a result of a lack of oxygen in the cells and high carbon dioxide in the blood, and that the high level of carbon dioxide in the body is the cause of death of corona patients. In addition to the lack of oxygen in the cells. Coronavirus treatment. I explained that the treatment of coronavirus after diagnosis is related to treatment of red blood cells, getting rid of the virus in the blood and making the cells work as they used to be. I note that giving the patient treatments to stimulate hemoglobin and red blood cells in order to return to work is a treatment for the coronavirus, and there is no pneumonia and no need for respirators. The coronavirus does not attack the lung at all, but rather penetrates through it into red blood cells and works to replace itself with oxygen to travel to the body's cells, thus disrupting their performance. Giving a corona patient chloroquine or hydroxy, in addition to hemoglobin treatments, which is currently available for treatment of corona patients, although chloroquine is a treatment for malaria, that is, chloroquine works to treat red blood cells, but the patient must be given hemoglobin drugs, which are available. Those who think that the disease resulting from infection with the COVID-19 has a relationship with pneumonia or fevers are delusional, rather ignorant. As you can see, they claim that it affects diabetics, people with chronic diseases, pregnant women, the elderly, and people with anemia, because these are the most human beings. They have problems with hemoglobin or red blood cells, and the reason is their iron deficiency. Therefore, to treat corona, the duty is to treat hemoglobin and red blood cells, not to treat pneumonia. I emphasized that the hemoglobin treatment is simple and available. It is to give the patient folic acid and iron pills, and because he has corona, doses of chloroquine are required to restore the cell activity. I also call on governments and countries not to be swept away by the fools of ventilators, the platitudes of pneumonia, and wasting money without success, and I ask them to provide chloroquine and hydroxychloroquine, in addition to the regular hemoglobin medicines. I concluded by calling on the countries of the world to sue the governments that do not care about research and scientific studies and which hide 90% of the facts and scientific discoveries, if not less than 100%. Thank you for watching the video. Do not forget to subscribe, like and share, so as to receive the new hot files.